Alberta Health Services has gone through many changes, and health services is now separated into health services and the corporate. So it's heavily bureaucratic. The healthcare of our people, we have to rely on frontline workers and their advice of doctors, nurses. In the past, Capital Health, when I was actively nursing at the Royal Alec and the university, the prime goal was to focus on Edmonton or Calgary as a center of critical care. Individual on why our integrated ambulance service is still in place is that a little guy was choking on a wiener, and it was just by our Drawson, and they couldn't get to a hospital or even getting an ambulance. An ambulance is one thing, and a firefighter is another thing. And that's why the integrated service in Strathcona was created. That little guy died, and because the proximity of a hospital, an active treatment, emergency room was not in close proximity. If everyone remembered the tornado that went through, and it went through, and the Sherwood Park Freeway seemed to be that corridor, every access to any hospital was cut off. And at the time, the plan was actually to put a facility in the north of Edmonton, and I think it was supposed to be the Royal Elizabeth Hospital, and that's what the Northeast Health Centre is. But there was also to look at the viability of having a facility in Sherwood Park in the east, and 100,000 people having access to health care and to doctors. That was very evident, that people needed to have access to emergency room. No, we don't want to have a hospital in every corner of the province. But when individuals talk about getting loved ones to a center or deliver their baby or just trying to get there on time, and we know that roadways and the congestion, they should not be fearful of that. Using your communities around and the hub and spoke of taking care of your elderly, taking care of delivering your babies, taking care of your basic health needs would take the pressure off the critical care facilities. The Mazankowski, cardiac, the Stollery, children, Lois Hole, women. That system worked. We need to now continue to look back into how we can end up engaging our community health and how we can ensure taking pressures off the emergency rooms and how we can take pressures off the ambulance service, which is also has been troubling for not only our large cities, but also our rural municipalities. This combination of frontline workers and putting the best dollar forward on behalf of the residents is important, because one of the basic responsibilities of government is health care and education.